So there are three types of diabetes. One is type 1 diabetes, type 2 diabetes, and gestational diabetes. So type 1 diabetes we see in below the age of 12. And the next one is type 2 diabetes. Type 2 diabetes we see in youngsters from starting from 17 years and above. And type 3 gestational diabetes we see only in females who are pregnant. So if some females, when they are pregnant, they will be having this diabetes in incidental finding. So for that, it is called as gestational diabetes. So it is mostly seen in pregnant women. India is now almost like second place in having most of the patients with diabetes. So what are the causes for diabetes? Main cause of diabetes is genetical disorder. Means genetically it will come from parents or grandparents. Second thing, stress related jobs, stress related life. And thirdly, uncontrolled food, junk food, outside food, or uncontrolled meals, and timely, if your patient is not having timely meals also, this also causes diabetes. So mainly, when a patient is having diabetes, the main symptoms he complains is like decreased weight, increased thirst, increased urination, and sometimes giddiness, and sometimes not able to concentrate. And these are the symptoms they just reveal to us. So for that, we go for a test, and if patient is having diabetes, it will be coming in the blood test. So what are the tests we do for diabetes? Is like fasting blood sugar is like uh, 12 hours, 8 to 12 hours of not having any food, and fasting when you get up in the morning, you go for a fasting. And then post lunch blood sugars is like after having your breakfast, and after that 1.5 to 2 hours, between 1.5 to 2 hours, you'll be having post lunch. So this is one type of test. And the second one is HbA1c. This is 3 months average sugar will be coming to us in an average way, where a normal values depending lab. So we normally take it as below 6.2 is normal. So above 6.2 we consider as diabetes or pre-diabetic stage. The third one is sometimes in urine also. We ask for urine samples also. In that urine samples, we see sugars or proteins or ketones. Sometimes ketones we see in a very bad stage, like uncontrolled sugars for more than 3 to 4 months. Ketones may be positive. So these are the investigations we do for diabetes. And coming to the treatment part, there are two varieties of medications. Like most of the patients in India, they go for tablets, oral hypoglycemic drugs, and the second one is insulins. So insulin also is one of the best treatment for diabetes at any age. So as we discussed regarding type 1 patients, we just suggest only insulin. Type 2 patients, we have insulin and tablet form. So tablets are taken in a moderate way, and when a patient comes to a physician or an endocrinologist, they prescribe some tablets and again recheck their sugar levels. So if it is not under control, then we'll continue the tablets. And if it's not under control, they increase the dosage. But recent studies shows that insulin is a better part for any type of diabetes. So we initially ask the patient for taking insulin for the medication, but most of the patients will be reluctant for that. So we mostly give tablets. So any tablet will be having their own side effects, but insulin has least side effects than any tablets. So we suggest insulin for this kind of patients. So these are the types of diabetes, and what are the clinical symptoms and what the treatment we have given. So what I request is daily, at least after age of 20-22 years, all the people, male or female, irrelevant of the sex, they have to go for a diabetic test, and they have to uh, initialize their symptoms. And if they are having any of the symptoms, as I mentioned earlier, they have to consult a physician. And secondly, diet is very much important in such kind of patients. Diet is the most important, plays a very vital role in diabetes. Diet and exercise. Every person after 25 years has to go for minimum of 45 minutes of regular exercise, like any aerobic exercise or swimming, jogging, and walking. Any type of exercise will definitely help you from disease with diabetes mellitus. So these are the things which I am giving you a brief idea regarding diabetes mellitus. Thank you.